Good morning. How are you, friends? This is Leslie from Leslie's Cancer Confessions. It is July 11th, 2020, the year that COVID forgot. I just wanted to touch base with you to let you know that I have had my first chemo treatment with Trodelvy, or IMMU 132. It is a drug that is currently being used to treat triple negative breast cancer, and they are testing it to see if it will work in treating and controlling estrogen receptor positive cancer. So yesterday was a very, very long day. After having split my day into 2 days, where on Thursday I went and had labs and saw my doctor and had an exam, which this all is normally done on one day, but they split it into two. And I travel essentially an hour to get to my appointments. So yesterday I had the second part of that, which was to get my port accessed. And after having no trouble with my port at all for the past 2 years, when they put it in, it gave them heck, and they had to bruise the crap out of my arm. See that big bruise right above my dandelion on my arm? I had 5 pokes yesterday to get through the day. So back to the beginning. They had to access my port because they did 2 blood draws yesterday, prior to the treatment and after. While I was just finishing up with the lab for the first blood draw, I received a call from my trial nurse. I have been assigned 2 nurses to work with me through the trial, and the plan is whether you receive IMMU 132 or Trodelvy, or you receive the backup drug that's being compared to Trodelvy, and there are 4 different drugs that they're using to be comparison drugs. And the one I would have been given would be Gemzar. Of course, they call it by the sciencey name in the study for study purposes. Anyway, after getting my labs done, I received a call from my trial nurse, her name is Betsy, to tell me that the computer had done the roll of the dice and that I had been, in fact, chosen to be on the trial drug, which ultimately that is what our goal was. I would have been happy either way, but I'm happier this way. So after that, they took me back and got me set up in the infusion room. They came and ran a EKG on me to get another EKG prior to the chemo, and then they did the chemo, which took 3 hours. There was the pre-meds, the chemo, and then after that they came and they did more blood work, and then they sent me to a special room in the area of the hospital where the clinical trial nurses work. And I waited there for 3 hours because you have to wait and let the chemo get into your system for 3 hours before they do their second EKG of the day. That's part of the study. And so they did post chemotherapy blood work, and then they did the after 3 hours EKG, and then I was good to go home. So I got there at 8:30 in the morning, and we left at almost 4 o'clock in the afternoon. And I imagine if they had not split the days into 2, we would have been there well until like 8 o'clock at night. It would have been a horribly, horribly long day. So I am taking nausea medication, whether I need it or not, because I threw up a lot with previous chemotherapies, and whenever they say it's a very common side effect, I just do everything in my power to avoid having that happen. So I'm taking Zofran in the morning, and whenever I feel the slightest twinge of nausea, I take it immediately. Also, Phenergan makes you a little sleepy, so I take that at night because it's the longest stretch of time that, you're asleep, so I want to continue to sleep. I don't want to wake feeling nauseous. So far, I'm just really super tired, a little nauseous. I have a lot of my normal liver pains. They had to give me breakthrough pain medication during my chemo treatment yesterday because I was experiencing, it's like a sharp stab of pain, and then it's gone, but then it moves to another spot. I have a lot of tumors, so it doesn't just stab in one spot repeatedly. It's just a lot of shocky, sudden, takes your breath away kind of pains. So I'm just planning on taking it easy. I have a really lovely daughter who came and took care of my dogs after she was finished with work yesterday, and made dinner for us, and is just helping out as much as she can around the house. That's super helpful. Of course, Mo is amazing. Made sure, since I was very anxious, very short of breath, made sure I had a wheelchair yesterday because, it's a long walk from the door going into all the different parts of the building where I needed to be yesterday. So as far as the chemo goes, I would say I'm doing pretty good for less than 24 hours after receiving it. And essentially, I think I'll be taking it pretty easy the rest of the weekend, and allowing people to help me more than I'm used to allowing it. But yeah, I got this girl. If you can see her, Sadie is hanging out with me, and also Gracie is hanging out with me, and Mo is doing a quick project in the garage, and life is good. If you have any questions about Trodelvy, anything at all, feel free to ask me in the questions and comments section down below. Give me a thumbs up if you like this content and want to see it continue. Also, subscribe if you haven't subscribed so that you keep getting notifications when I have new videos. And there's a little bell next to the subscription. If you click on that, you will be notified every single time I post something, video content or otherwise, and that helps me to know that you're seeing the content, and it helps me to know if you like the content. Any negative comments to me or to each other will be deleted and reported, so please be kind. The world sucks right now, and we just need people to be better. So I love you all. Thank you for stopping by. Refer this to anybody you think it might help, and let me know what's going on with you. I'll talk to you soon. Bye.